Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about ketone bodies. We are going to see detail about ketogenesis as well as ketolysis and their symptoms and diagnosis. Now, we will see about the ketone bodies. The ketone bodies are three, which are acetone, acetoacetate and beta-hydroxybutyrate. In it, first form is, which is a primary form of the ketone body, is acetoacetate, and the secondary form is beta-hydroxybutyrate as well as acetone. The acetoacetate is the primary form of the ketone body, and the acetone as well as beta-hydroxybutyrate are the secondary ketone body. The ketone bodies are water soluble and energy yielding components for peripheral tissue, mainly for brain. Generally, these ketone bodies are useful they are water soluble as well as they are energy yielding compounds for peripheral tissue and brain when there is a condition of starvation. The RBCs cannot utilize the ketone bodies due to absence of mitochondria. The RBCs are generally cannot use these ketone bodies for energy due to the absence of mitochondria because ketogenesis occurs in mitochondria. So when there is absence of mitochondria in the RBCs, this ketogenesis cannot be seen in RBCs. So these energy cannot be utilized by RBC. Ketogenesis. Synthesis of the ketone body occur in liver and mitochondria. As I have said, so that the mitochondria is not present in the RBCs, so it cannot utilize it. Acetyl-CoA is a precursor for the ketone body formation. Generally, acetyl-CoA is a major thing for the formation of the ketone body. The acetyl-CoA to the ketone body. This is known as ketogenesis. From the acetyl-CoA, how it is changed into ketone body. It is known as ketogenesis. The rate-limiting enzyme is HMG-CoA synthase. The acetyl-CoA plus another molecule of the acetyl-CoA with the help of enzyme which is beta-ketothiolase changed into acetoacetyl-CoA. From the acetoacetyl-CoA by the HMG-CoA synthase, this is a rate-limiting enzyme, plus acetyl-CoA, it changed into HMG-CoA. From that HMG-CoA lyase, which breaks down, the HMG-CoA breaks down by the HMG-CoA lyase into acetoacetate. And this is which is the primary form of the ketone body. From it, there is a spontaneous form of acetone, which is the secondary form, as well as dehydrogenase into beta-hydroxybutyrate. The acetoacetate can be formed from the leucine, lysine and phenylalanine and tyrosine. This acetoacetate, this is the primary form of the ketone body, can be formed by the leucine, lysine and phenylalanine and tyrosine. This HMG-CoA lyase is present only in liver, which is the rate limiting enzyme. Now we will see about the ketolysis. The breakdown of ketone bodies are known as ketolysis. When the glucose is not available in the tissue like skeletal tissue and brain, when the glucose is not available, the tissue like skeletal tissue and brain utilizes the ketone body as an alternate source of energy. When there is absence of glucose in the body, the skeletal tissue as well as brain utilizes the ketone body as an alternate source of energy. This is known as ketolysis. The ketolysis means breakdown of ketone body are known as ketolysis. When the breakdown of the ketone bodies are acetoacetate and beta-hydroxybutyrate. These three which are breakdown which is known as ketolysis. When there is absence of glucose in the body, the tissue utilizes this ketone body as a source of energy, which is known as ketolysis. The tissues are skeletal tissue as well as brain. The ketolysis is just opposite to the ketogenesis. Beta-hydroxybutyrate, which undergoes beta-hydroxybutyrate dehydrogenase to form acetoacetate. This acetoacetate from thiophorase. This thiophorase is the only which is absent in liver. So the liver cannot utilize this ketone bodies. So the acetoacetate, which is changed into acetoacetyl-CoA by the enzyme which is known as thiophorase. This acetoacetyl-CoA changes into 2-acetyl-CoA by thiolase. And this acetyl-CoA enters TCA cycle and produces ATP, which is energies, as well as CO2, the end product of the TCA cycle. The thiophorase is generally absent in the liver, so the ketone bodies are not utilized in the liver. During prolonged starvation, the ketone bodies are the major fuel source for brain and as well as CNS. When there is no glucose in the body or during prolonged starvation, the ketone bodies are the major fuel for the brain and the CNS. The ketone bodies can nearly meet 70% of the brain's energy requirement. When the ketone bodies can give 70% of the brain's energy. Ketosis. Normal level of the ketone body in the blood is less than 1 mg per deciliter. Normally, the ketone body level in the blood is less than 1 mg per deciliter. When there is increased in the synthesis of the ketone body, it causes accumulation in blood, and this is known as ketonemia. When there is increased synthesis of ketone body, there is accumulation of the ketone body in the blood, which is known as ketonemia. And this ketonemia leads to the excretion of the ketone bodies in the urine, which is known as ketonuria, and the smell breath, which is known as acetone breath. There will be a breath which is known as acetone breath. Then the cause of ketosis is due to diabetes mellitus and prolonged starvation. Symptoms. The symptoms are Kussmaul's respiration, dehydration, metabolic acidosis, reduced buffer, sodium loss, as well as coma. These are the symptoms of the ketosis. Now you will see the diagnosis of the ketosis. How the ketosis can be diagnosed? By Rautra's test. The Rautra's test is used to diagnose ketosis. The saturated 5 ml of urine with the ammonium sulfate. When the 5 ml of urine is added with ammonium sulfate and 3 drops of sodium nitroprusside is left in this solution, which is the mix of 5 ml of urine and ammonium sulfate plus the 3 drops of sodium nitroprusside, and there is 2 ml of liquid ammonia is put along the sides of the test tube, and these drop just go and meet the liquid which is present in the test tube, and there is a formation of the liquid at the junction of the test tube, which is a purple ring formation takes place there, and this confirms that this person is Rautra's positive. Rautra's positive means the patient is diagnosed as a ketosis patient. He undergo ketolysis. Thank you. That's all about the ketone body. We have seen about the ketone body, ketogenesis, as well as ketolysis, and the symptoms and cause of the ketosis. Thank you. If you like this video, please to like, share and subscribe my YouTube channel. If you have any doubt on it, please to comment it. If you want any other topic, please to comment it. Thank you. Please to subscribe.